Ladies and gentlemen of the bailiwick, welcome. When I and my colleagues last spoke to you on the 11th of December, we thought that would be it for Christmas and that we wouldn't have to bother you or concern you again. Well, we're certainly not concerning you, but this virus is no respecter of Christmas, and we don't want it to bring any unnecessary presents to anybody. So what I've got today is a full panel, all my colleagues here, to answer any questions that may come from the media. But this is a one-issue specific briefing, really. And of course, it's caused by the fact that most of you listen to the radios, watch the TV, and seen in the past few days there's been a new variant of the virus which gives rise to COVID-19, which has expressed itself in an unfortunate fashion. It's a mutation of the virus in the UK. So Dr. Brink is, in just a minute or two, going to tell you why we've responded to the findings that she has helpfully drawn to our attention in the way that we have. But we had a meeting of the Civil Contingencies Authority this morning, and we unanimously decided that with effect from a minute ago, there will be new regulations in force, or at least a variation to the regulations. And that variation is that anybody returning from a Category 4 country or region, which includes anybody that comes into direct points of reference and entrance into the bailiwick, will have to have a day 13 mandatory test. If they do not have a day 13 mandatory test, then they must stay in isolation for a total of 21 days. So the persons will have the option to either take the test at day 13 or they wait another 7 or 8 days before they are released from self-isolation. Now that will also extend to anyone who's choosing to self-isolate with a traveller, even if that person or those persons haven't themselves travelled. They will face the same requirements, and again there will be a mandatory day 13 requirement for a test or self-isolation for 21 days. Now, in the next couple of days, because there is obviously some people who are coming up to their 13th day very soon, officers will attend and make arrangements for those and those isolating with them to ensure that the regulations are enforced. Those are severe regulations. Anyone breaching them will be prosecuted, and there are fines of up to £10,000. So we ask people to be, as they've been almost universally to date, vigilant and continue to adopt and follow those regulations. Now, children under the age of 12 who arrive in the bailiwick are still not going to be required to test, but they will have to have a test on day 13 if they're going to go back to school or preschool or nursery or childcare. Otherwise, again, the 21-day period that I've referred to will apply. Now, we know how quickly things can change, and we know that we must continue to have the right measures. We've done so to date over the last 10 months, and I'm sure we'll continue to do so over the months that still have to elapse, because before we can put this virus behind us. We're not there yet. The bailiwick has done massive good work. The people of the bailiwick have been overwhelmingly responsible, and we ask you to continue to be vigilant. Now, we can't drop our guard. It's too important. We're not past the finishing post yet. You never are in a situation such as this for some time to come. Anyway, I'll now ask Dr. Brink to take us through what we know and what she knows about the new variant and the evidence that's made us cause to take the decision that we've taken today. Dr. Brink.
Thank you very much, Deputy Fairbrush. So I'm going to give you a brief update of our current situation, our current figures. I'm then going to follow it by a quick update on what's happened with regard to the first vaccinations that we've rolled out, and then focus much of the time on the new variant of SARS-CoV-2. So we currently have 4 active cases in the bailiwick, and we do have 1 individual in hospital. And I think it's really important. We are in an extremely favourable situation that we don't have any evidence of community seeding of the virus. All of the cases that we've had have been travel related, and none of them have transmitted on to other contacts. So that's really encouraging from our perspective. Now, the other point that's really important to focus on here is the absence of community transmission of the virus also means that it's far easier for us to roll out our vaccination program. So we're in a very strong position, and we need to try and hold that position. So with that, I just thought I'd focus on our day 13 diagnoses. And we've just looked at the last 20 travel-associated cases that we've had, and of those, we detected 3 of those on day 13. Now, of course, those people can have been infected any time from the time of their negative test on arrival during that 13-day period. But we did detect 13 people who were infected and infectious on day 13. So the rest of the individuals were either diagnosed on their day of arrival test, or they became symptomatic during the period, during that 14-day period, and we did testing because they were symptomatic. But important to focus that 3 people were detected on day 13 and were indeed asymptomatic. So really important information. So I also wanted to update you on the vaccination program, and we've had an extremely successful first rollout. And again, I want to pay testament to all the health and care workers in the bailiwick. We put out a call for vaccinators, and we had more people come forward than we needed, which has been absolutely fantastic. So we've had people train up, do the training to become a COVID-19 vaccinator, and we owe a huge debt of gratitude to all these people that volunteered. On Saturday and Sunday, we were immunising from 7 in the morning until after 10 in the evening. So people gladly gave up their weekends to be part of this programme, and we need to thank them all. So we've immunised a combination. We've put out a press release of care and residential home staff, nurses, doctors, paramedics, other frontline workers, first responders. So we've immunised a combination of individuals. We've planned it very carefully because obviously the vaccine does have some side effects. I have to say most of us who have had it have not experienced very many side effects at all, but there can be side effects, and so we need to make sure that our workforce remains resilient and we can service the needs of the population. So I think that's important. But our conclusion from the first step is a very successful rollout. The next round of vaccination will be the cohort 1 will be due for their second dose of vaccine, and that will happen on the 7th of January. And then we'll have a further rollout on the 11th of January, where we're looking at immunising care and residential home residents, the remainder of care and residential home staff, and then starting on the other health and care staff and the over 80s, and then we'll be going down the priority programs. So that's where we are with the vaccination program. So very pleased with the initial response. Now, what we want to focus on today is the new variant of SARS-CoV-2, which is the virus that causes COVID-19. And the analysis that's happened in the UK has shown that there is a new variant. It actually has 23 mutations, but there's one mutation of particular interest, which is in the spike protein of the virus. Now, I think we need to focus on the fact that it is not uncommon for viruses to mutate, and particularly RNA viruses to mutate. So this is something that we've been expecting. But the initial evidence that we've got from this virus is that it does appear to be more infectious. So we think that it's about 70% more transmissible. So really something that we need to focus on and need to be aware of. And I think that's important. And it came to our knowledge through clusters of cases that have occurred in the southeast of England, the east of England, and indeed London, where you've seen rapid growth of this variant virus, and in some regions it's now accounting for 60% of cases. So really important that we focus that this is a variant of the virus and it is spreading rapidly. And I think it's entirely right and appropriate for us to respond to this new information. So the first thing that we looked at, and we looked at it yesterday, was the testing. So our laboratory testing targets various parts of the viral genome, and we've always been cognizant of the fact that this is an RNA virus and it can mutate. So we've targeted multiple areas of the genome. So our frontline assay, for example, uses a combination of a nuclear protein, N protein, together with what we call an ORF protein target, and then we have a confirmatory assay which has 2 different targets. Now, we've looked at the sequence of the area of the genome that we're targeting, and we're absolutely happy that our testing is not compromised by this new variant. So our testing would pick up this variant if we were to see a case in the bailiwick. So I think that's really important. So the other thing that we focused on is looking at the non-pharmaceutical interventions and the role of these in reducing transmission of this new variant. And I think it's really important that all the evidence is that the non-pharmaceutical interventions, the hand washing for at least 20 seconds, the catch it, bin it, kill it, the respiratory hygiene, respiratory etiquette, respecting people's personal space, staying at home if you're unwell, all of those are really relevant for the new variant of virus and are more relevant at the moment whilst we get to understand this variant virus. So really important that we adhere to all of that and we emphasise the need for that within the bailiwick. And we're confident that these procedures will be important in reducing the transmission of the variant virus. So we focused yesterday on looking at what our next steps should be. And bearing in mind the role of the non-pharmaceutical interventions, we looked at the mandatory isolation and testing. And the recommendations, which has been endorsed by our STAC, is that we have a mandatory day of exit testing, which is usually on day 13, and that takes place with immediate effect. So that will then provide us further protection with any escape of that variant virus into the community. And we feel that I'm recommending that if any person doesn't want the day 13 test, they will be then required to do an extended period of isolation up to 21 days. So the reason why we put the extra 7 days on, it provides that additional level of protection, because if someone tests on day 13 positive, we don't know when during that period of time that they become positive unless they've developed symptoms, in which case we can time it. So the additional 7 days just provides us with a level of protection, provides our community with that additional level of protection. The other thing we wanted to focus on was the role of travellers that were isolating with people living in the bailiwick. And those people, if they're isolating together, will also be required to have a day 13 test with, and if they decline that, the additional 7 days of isolation. So those are the main messages we want to bring today, and I think it's always important that we're proactive, we respond early, and we do everything we can to keep the bailiwick safe and keep ourselves in our very strong position that we're in. So
thank you very much, Dr. Brigg. Are you looking as though you were chomping at the bit there, Deputy Salisbury? I think you wanted to say something in relation to the point that Dr. Brigg was making.
Yeah, I would think in terms of evidence, and we've always said that we'll follow the evidence and make changes if appropriate. And this is a classic example. I know there have been people saying have mandatory day 13 tests far before now, but now it's the evidence showing that we really do need to with the variant, I believe, isn't it, Nikki? That it's that seeing how far more infectious it is, and how once we get it into the community, it'll be much harder to get control of it. That we really need to bring in this change today.
Yeah.
Okay.
Absolutely, it's more transmissible, so we've got to have that additional level of caution.
Questions, please, from our assembled media. Yes, sir.
Keelan Webster, ITV News. There was a bit of chat about perhaps you could move back to only essential travel within the islands. Was that ever considered at all?
That's still something we will consider. We'll see how things go. I don't think we need to right at this moment. We have discussed it, but we think at this moment what we're bringing in is sufficient.
Yes.
James Rody, BBC Guernsey. How do we know if somebody doesn't have to have a test, they could take the extended isolation up to 21 days? How would we know for sure that when they came out at the end of 21 days they weren't infectious, especially as they could be asymptomatic?
Dr. Brigg?
So the extra 7 days will provide us with a very significant risk reduction to prevent that happening. The chance of someone coming out having arrived on a day and 21 days later still being significantly infectious are going to be very low. So it's to provide that additional level of caution on top of the initial 13 days.
Is it possible that there'd be a point in which a test is, you have to have a test, it's mandatory, there's no choice about it?
So the law that we're passing is that you have a day 13 test, or alternatively you do the extended period of isolation, and we think that's a reasonable balance. I don't know if you...
Yeah, indeed, that's exactly right. We're not going to send people round with a needle to inject people, but they've got the alternative. They either have the mandatory test or they stay another 7 or 8 days in isolation. And just following up the point that Dr. Brigg has made, scientific evidence is beyond 21 days you're safe. Should, in a very, very unlikely event that change, then obviously that period may change, but that's not contemplated at the moment. You want to ask a question?
Helen Bowditch from the Guernsey Press. I mean, did you think about making the test on arrival mandatory as well? I mean, I know people are going into the self-isolation, but did you consider that?
I don't think we did at the moment. But again, all these things are under review. We believe that the step that we've just taken, that's now been in force for 15 minutes, will deal with the situation as it currently is. But as I said to you, and as my colleague said to you, when we were here, 11 days ago, we didn't think we'd have to be speaking to you again before Christmas. We're pleased to do so, obviously, and we will do so as often as is necessary. But we believe that the steps that we've taken at the moment are proportionate and reasonable.
For people who might have already gone back to the UK for Christmas, should they be concerned that you might bring in a travel ban coming back to Guernsey, or is it a case of you're obviously still watching things very closely?
Heidi, do you want to deal with
Well, we are watching things very closely. As you'd see, it's been quite a fluid situation. We've seen the numbers in the London South East really rocket. We then, at all times, we need to assess what we should do based on what's happening around us. That's always been the case. But at the moment, we'll be still looking at it over Christmas, New Year, and see what else we need to do. So we can't say yes or no where we'll be, but this is where we believe we've got it right for the situation we're in at the moment.
Paul, I think you want to add something.
Yeah, just to add to that, I think that's very real, and as Deputy Salisbury says, we continuously look in front of ourselves in case we needed to apply a change to restriction and being flexible on that. But I think obviously if we had normally residents of Guernsey, we wouldn't abandon them off island. And as much as we saw at the beginning of this crisis, we then looked to see how we would repatriate those that had gone away for Christmas and do so in a safe way.
Any other questions?
James Raby, BBC Guernsey. Just on the vaccine itself, you say there's going to be a further rollout on the 12th of January to more people. Do we know at the moment how long the vaccine lasts?
Yeah.
So, no is the answer. So the data is coming out all the time. So that data will only come out in the year or so to come. So that's being monitored really closely, and people are looking not only the duration of antibodies, they're looking at the protective effect against COVID-19 disease and COVID-19 deaths, but also as more people are immunised, we'll get evidence on transmissibility. So there are a lot of questions that still need to be answered, but the preliminary information on preventing disease and death, certainly in the short term, is promising.
Yeah, I mean, the point made in relation to that is please take the vaccine as soon as you can, as soon as the opportunity presents itself. You're protecting both yourself and you're helping others in the community. I think you wanted to add to it.
Just to confirm what the Chief Minister says, basically, please, everyone, take the opportunity when it comes to you to take up the vaccine.
And of course, people will be taking this opportunity up come the new year as the rollout extends. Could you just explain what the side effects might be, just so people are aware?
Dr. Reed?
So the side effects of the vaccine, the most common is going to be some pain at the site of injection, perhaps feeling a bit tired afterwards, feeling a bit headachy has been described. There are more serious side effects, so you can get things like enlarged lymph glands. These are really, really uncommon. And the most people that have had the vaccine have been really absolutely fine afterwards. Perhaps some mild side effects. I mean, the only thing I noticed when I put on my coat, I could feel I'd had something in my arm, and that was it. Other than that, I felt absolutely fine, and I think the majority of people are reporting that as well.
Anybody else? Yes.
Do you have any statistics or an idea of what the general uptake on day 13 test has been up until now?
Yes.
Yes, in the region of 66%, well, absolutely 66%. And so we're hoping it will obviously increase.
Yes, then I'll come to you a bit later. Yeah.
James Roby, BBC. So when it comes to the extended isolation now, if somebody has to go for 21 days, they could be, say, on day 12 now, for instance, and now they'd have to extend it. If they're staying in a hotel for that period, what happens there? Is it just going to have to come out of their pocket and they're just going to have to stomach that bill?
Well, the answer to that is yes, unless they're assisted a different way. We've got to look at the greater good. And if they, therefore, but the remedy is in their own hands, because they can decide on day 30, they'll take the test. And if they decide they don't want to, they've got to stay in a hotel and that's being funded by themselves, and that's what will happen.
But then if they're positive on day 13, they'd have to stay over anyway. So
Indeed.
it's a risk you take.
Yep.
With dozens of countries closing their borders to the UK and, the watchword of the Bailiwicks campaign up until now has been caution. With the 5 of you, were you all unanimous that a restriction like that just wasn't needed at this stage?
Yeah, well, we've been in a different position to lots of other countries with the border regime we've got and the testing regime we've got. If you want to add more to that, Nikki.
Yeah. So we've always had a more conservative border regimen, and we've put testing on top of it. So this we kept carefully under review. More data is coming out about this variant all the time. We'll get more information from Port and Down and some of the big laboratories that are doing very detailed research on it. But one of the things that I attended a meeting yesterday afternoon, and one of the things that really was highlighted was the stringent need to adhere to the non-pharmaceutical interventions. And that'll be the best first-line protection for us. So increasing our border, providing a stricter border policy, but also within the bailiwick, just reminding people about those messages, you know, the hand washing, the respiratory etiquette, the stay at home if you're unwell, now is more important than ever that we stick to all of that.
So again, the shops, I've mentioned this before, put out sanitisers for people.
Yeah.
Please use them. I've seen people walking past and they completely ignore them. They need to. I mean, some people might be wearing gloves, fine, but you know, if the sanitiser's there, please use it. I mean, it's for the community's benefit.
Yeah, and just as Paul was saying, we've got a lot of people of our community are off island at the moment. They will be coming back over the next few weeks. It's really critical for us as the whole community that when they do so very carefully, and we have to encourage them when they come back to follow all the guidelines, and picking up just what Heidi and Nikki are saying, that it really is a very strict isolation for the 14 days or the 21 if you opt for that, because that's the only way we're going to protect ourselves.
Paul?
Yeah, I was just going to add to Deputy Burrard's comment, and I think the emphasis has very much been today on the traveller, and of course those that have chosen to bubble with a traveller on the requirements for that 13-day test. But we would also really want to put that emphasis on those that are self-isolating in a normal household. The very real requirements for that to be true self-isolation. Please do not look for individual home workarounds that then put them at risk, because we've seen, and it was expressed by Dr. Brink this morning, that potentially a 70% increase in transmission rate. So that gamble that you might pay to say, well, this person can sit at the other side of the room with the window open, is too great for our community. Self-isolation is self-isolation.
James?
How many people have had their first vaccine jab so far, and do we know when the next batch of the vaccine will arrive on the island?
968 have had their first jab of the vaccine. The second delivery of 975 doses already on island, and we're expecting a further delivery in the week of the 4th of January.
Good. Yes.
Could you give us an update on how the person in hospital is doing at the moment?
Don't comment on individual cases, and I think that's important. We've always protected our patients' confidentiality, and I think it's really important that we allow someone in hospital to recover in peace and confidentiality. So I'm afraid I'm not going to give you any more details on that.
And that'll be our consistent approach going forward, as it has been in the past. Yes.
I think you said 11th of January was when the care home residents were going to start being vaccinated. Do you have any ideas of timescales beyond that? Because I think it's the over 80s group next. I know people are they're desperate to find out when they're going to be vaccinated. And what are the logistics of giving the vaccinations to care home residents? Are you going to have a mobile unit? How's it going to work?
So I would also love to have a definite programme that I could do a timetable and plan all the staffing and so on. We are to a degree dependent on the vaccine deliveries from the UK, but also we are awaiting the news on the Oxford vaccine. So there are a degree of uncertainty. So I can't do a precise timetable at this point in time. With regard to the delivery in the care homes, we have gone through a detailed protocol which we've discussed with the MHRA, where we can move the vaccine from the Princess Elizabeth Hospital into the care homes. We use what we call vaccine porters, which are particular containers, and we have receptacles that we can put the vaccine upright and transport it carefully to the the care homes. So we will be delivering it to residents within the care homes. That is our anticipated programme at the moment. We will continue to use the Princess Elizabeth Hospital as our secondary satellite. We managed to get 968 people through there over a period of 4 days. Once we take the vaccine out of the minus 70, we have 120 hours to deliver the vaccination programme and to deliver all of those vaccines. So I hope has that answered all of the questions you asked?
Is it worth pointing out, so I don't think we have done so far, that there was only 7 vials which you couldn't use for one reason or another, but that's hardly anything in terms of wastage, but the actual plan, that the assumption is that 20% could be lost through wastage. So the guys that have done this, has been an absolutely fantastic job to get 968 vaccinated, so a lot of credit to everybody who's taken part in that.
So it's 7 dosages, not 7 vials, because each vial has 5 doses in. So,
Anybody else with a question? Yes.
Oh, I was going to stick my head around the Sir John Loveridge Hall before, but I didn't quite have enough time. But how are the preparations going there?
It looks as though they go well, Paul.
Yeah, absolutely. Most of the sort of build work that's required is all completed. The kitting out's been also addressed, and now we just have the plans that we can actually operationalise it very quickly within 10 days, and obviously do some of that testing that we talked about previously.
Anybody else with a question? Yes.
Someone contacted me just before I came here, and they said it would be nice maybe from the 7th of January if you could put an extra column in your COVID daily statistics, just sort of saying how many people have been vaccinated as a positive thing.
I think it'd be good.
Yeah.
I think I see Dr. Briggs nodding, so that looks as though it's going to happen. Anything else or anybody else? Well,
I was going to just... any sign that this mutant strain has come up in the cases in Guernsey?
So to detect the mutant strain, we would have to do full sequencing of the virus. As a matter of good practice, we will send our last isolate off island to be sequenced. We won't get the result back. It'll take weeks to get it back, but just so that we get a good handle of what's going on. You know how much I like the evidence of what's going on, and we need to have a good map of what's going on. But we'll wait and see what we get from that. But that I would have done anyway in the face of a new variant.
anybody else with a question? Well, again, we did on the 11th of December. We do it again on the 22nd of December. Wish everybody a happy Christmas, but be careful, be vigilant, and then hopefully we'll all continue to be happy and healthy and enjoy a good Christmas and beyond. So happy Christmas to everybody.